Hey guys! Long time no update, huh? So I apologize for that. I know it's been a couple of months, probably close to 2 or 3 months. I think Mother's Day was actually the last time that I posted a vlog update. So I'm sorry it's been so long, and I'm sorry that I've been neglecting all of your comments and everything. I'm sorry. Life has just been really crazy lately. I'm back into the swing of things with work, and also I am back at it full time with my classes. And this summer I had summer classes, and they were fun, but they're over for right now, so I have a couple weeks of a break before they start back up. So I figured that it is time for me to do a vlog update. So I'm coming to you right now from my living room floor because my computer is being weird and I have it plugged up to the power cord right now. So what's up from the floor? Okay, so like I said, everything has been going really good with me. I've been feeling really healthy overall. Things have been good. I am getting pretty close to being plus 11 months post-transplant. Next month, on September 22nd, will actually be plus 1 year for me, which blows my mind. I cannot even believe that it has already been almost 1 year since I got my transplant. I have no words. I'm literally at loss for words for this because I can remember that all so vividly, and just to think that it's been a year almost now, I don't know where the time has gone. But luckily, I've been very blessed, and this past year has been one of healing and learning and just kind of learning a new normal, I guess you can say. But I've been doing well. I don't take any kind of transplant medicine anymore. The only thing that I still take related to transplant, related to AML, is I do take a cyclovir, and I still take that twice daily. And from as far as I can tell, my doctor said that I will take that for, who knows, maybe forever. I don't know. But that's it as far as transplant related drugs go. I've been very blessed with everything. No issues as far as, graft versus host goes. Nothing, like no chronic GVHD creeping up or anything. This is my hair situation right now. I don't know what's happening on top. It's still a little bit thin on top there, but it's coming in slowly but surely. I'm working on getting a mullet back here, if you can see it. My hair is getting kind of long there in the back, but it's coming in. Yeah, I do still have issues with fatigue for sure, and then also with concentration. It's still an issue for me as well. And every time I talk to the doctor about that, he always just, reminds me that, in the grand scheme of things, I'm really not that far out from transplant still. I am close to being 11 months out, but when it comes to healing, that's not very long. But in my brain, I think it is a long time. So I'm just hard on myself about it, but I shouldn't be, and I know that, but, But yeah, just fatigue, concentration, my memory, it's getting there. I can tell it has definitely improved as time goes on, but it's still not quite where it was before. But, I guess I'll always have the chemo brain moments, but whatever. So, yeah, I think that's it for me. I'm just doing good, and I'm very, very blessed, and like I said, I just absolutely cannot believe that it has been almost a year since my transplant. But, okay, anyways, I figured that since I have been a very bad vlogger over the past few months, and I've kind of, just neglected my vlog here and I hate to say it, and I'm sorry for neglecting your all's comments. I would go through and answer some of the questions that you all left on my videos. So I'm sorry if I'm missing someone, if I miss your question. I am going to go back and go through my history and comment on everyone's posts just to make sure that I don't miss anyone, but I wanted to go through and talk about some of the questions that you all have asked me that were showing up on my notifications on my phone. So the first one here that I'm going to talk about is I got a couple of comments from Darlene. So hi Darlene, from what I can tell, your daughter is going through AML right now and going through treatments. So my prayers are absolutely with you all in that, and I hope that things are going good for you guys. Definitely just, everyone keep strong, and that's the best thing that you can do in this situation. But to answer your questions here, let me see. I see where she was getting small blisters on the top of her hand and asked if I had any idea what that could possibly be. The only thing I can really think of would, I don't know what the blister looks like, of course. I would kind of, oh, why is my computer doing this? Okay, I think it's back to normal. Sorry. The first thing that comes to mind when there's any kind of skin issues would be, of course, graft versus host disease. But I don't know that your daughter had received a transplant, so that may not be the situation. I'm sorry. I'm trying to think if before transplant, if I had any kind of skin issues like that would be like blisters. Oh, then I see tech. Okay, so maybe she did have a transplant. I'm sorry. I'm so unprepared. I'm terrible. Okay, so like I said, the first thing I would think would be graft versus host disease. If not that, it could possibly be hand-foot syndrome. I think is what it calls. I always get that one mixed up. But I talked about it in my one video. Whenever I had the hand-foot syndrome, it wasn't necessarily blisters, like how you get blisters from a burn. It was more so just like bumps, but they weren't fluid-filled. So that may be what's going on. Whenever I had that, there wasn't really anything that relieved it. It was just, I kept lotion on it, I kept hydrocortisone cream on it. But from what I remember, there wasn't anything in particular that really got rid of it or kind of helped it. It was just time. And I see where she's having the darker skin and then the fingernails. So I have much sympathy for her and much empathy, because that's not fun at all. I remember that. And it's not fun. You just feel so uncomfortable. So I do hope that she is doing better and that maybe she found some lotion or something to kind of relieve that discomfort. So hopefully she's doing better. I see that she's on tacrolimus, so I was on that as well, and I was on it for, I think I probably mentioned it in one of previous videos. I was on it, I would say maybe 8 or 9 months total after transplant, but I am off of it now. And you asked, when do platelets go back to normal? Well, I think that just depends on everyone. I was fortunate enough that right after transplant, once my counts did recover, my platelets were normal from that point on. For people, the low end of normal for platelets is around 140. So I don't know, how long it takes for other people to go back to normal. But for me, I was, once my counts recovered, they recovered and they stayed like that. So I was very lucky in that aspect. Another question that Darlene asked was just about counts staying up in general. She said that her daughter is on day 70 and her counts has dropped somewhat. and if that's normal. Well, like I just said, once I got my transplant, and it took about 2 weeks for my counts to recover from the transplant with my donor cells at that point. Once my counts recovered, they stayed recovered. I never had any fluctuations, really. They never dropped again. I've just been fortunate where once they got up, they stayed up, that being my white blood cells, my red blood cells, and my platelets. I don't know if that's normal or if I've just been really lucky. Of course, the doctor would be able to tell you. And then same thing with my ANC. Once it, got up to a level where I wasn't neutropenic anymore, it never fell back below that. But, of course, with everything, I just was very, very vigilant about hand washing. I washed my hands all the time because I was terrified of getting sick. I used hand sanitizer all the time, and I would change my clothes all the time. Like if I went to the hospital for a doctor's appointment, I would change my clothes as soon as I got back home. I just was very vigilant about all that because I was afraid of getting sick, and I was afraid of my ANC and my white blood count, dropping or getting affected by any of that. So like I said, I think I just have been very lucky with everything. I see where you mentioned about her having CMV acting up and they're trying to get it under control with medicine. Again, I was very lucky and did not have to take that special medicine for CMV. If I remember right, there was a week or two after transplant. So it was after I was out of the hospital, but during the time where I was staying at the family house next to the hospital. It was during that time there was some issues with my CMV level. They were thinking that I was going to have to go on that special antibiotic medicine to get the CMV level down, but I didn't have to take the medicine. The CMV level went down on its own. I'm trying to remember the details of all that, but I really can't remember what it was that fixed it, so to say. I think it was one of those things that kind of just worked out on its own, thank goodness. But again, there was that issue, the concern of there being an issue with it, but luckily it never got to that level where I had to take the medicine. So I hope that they were able to get things figured out as far as that goes, and that the medicine helped to get that CMV under control. So, next question here I have is from Officer of the Watches. Is talking about how brother-in-law got chemo and a booster treatment. Question is, doctor never mentioned about bone marrow transplant, and can he recover without bone marrow? I'm assuming bone marrow transplant in your experience. So there are, of course, different ways of treating AML. Bone marrow transplant is just one of the ways. Of course, chemo, what they usually call it consolidation. Chemo is another way to treat it. Every doctor is different from what I have learned, with talking to lots of different people who have AML. Different doctors, different, cancer centers all do things different ways. For me, in my situation, bone marrow transplant was the only viable option to keep the AML away, hopefully. They always told me that the bone marrow transplant for me was the best shot at a cure. My AML was complicated by a couple of different factors, genetic factors. Okay, so I take back what I said earlier about not having chemo brain, because my chemo brain is flaring up right now. But anyways, my AML was complicated by a couple of different things, so they figured that if I would just do consolidation chemo, that it would probably come back in the future. So they went ahead and went forward with bone marrow transplant immediately, and like I said, they just told me that that would be the best option as far as a cure goes. And like I said, you know, almost 11 months out, and I've been extremely blessed and extremely lucky that I haven't had any significant side effects from transplant. So some doctors, you know, it just depends on the specific AML, the specific patient, the specific situation, you know, what hospital is treatment options they have at the hospital. Just a whole bunch of different factors goes into whether a bone marrow transplant would be the best option for someone, or if solely chemo would be the best option for someone. And second part of the question, he would like to start smoking, believing, and his doctor told him that smoking did not cause this. Well, what do I suggest? Well, of course, I suggest do not smoke. I'm assuming you mean cigarettes, or anything for that matter, actually. I would suggest not smoking, because smoking is very dangerous and has been linked to other cancers and other diseases, of course. I don't know if smoking has ever been linked to leukemia, though. I'm not sure about that, because smoking typically, you know, is of course, you know, linked to lung cancer is what we think of, but also smoking can be linked to, you know, mouth cancer, throat cancer, the whole tract of cancer here, you know, and a whole bunch of other things as well. But I don't know about smoking and leukemia, but it's possible that they, you know, could be linked, they might not be linked, I don't know. But like I said, all in all, I just would suggest not smoking. But I'm not a doctor, but that's just my, you know, humble opinion. So I hope that answers your questions. I think I missed some here. I'm so bad at this. I'm sorry, guys. I saw a comment from 008 Invisible Man saying about how he's going to the doctor for blood tests and a bad feeling that might be leukemia. And I'm sorry that you're going through that. I really truly am. I remember that very vividly, and I remember how scary that was. And I can remember just praying and trying to just figure out any possible way to heal myself, because of course I didn't know what it was at the time, but I just remember being so scared and being so angry at myself too, though, for, you know, doing whatever I did to make myself sick like this. It was a very confusing and difficult time, so I really do hope that you found some answers, and no matter what it was, just stay strong. And, you know, if it was leukemia, you know, just stay strong, kick its butt, because you can do it, and don't let leukemia get the best of you. You get the best of leukemia. So just, you know, let me know if you see this. Let me know how things went. And like I said, I'm going to be commenting on everyone's post directly. So again, I just hope that everything is okay. And then another similar comment from Carla saying that she has symptoms pretty similar to what I was experiencing. She's very afraid and unsure of what to do. So Carla, I hope that you have gone to see your doctor. I hope that everything is okay. You know, of course, the symptoms I experienced are pretty general. You know, they could be for a whole wide range of things, not necessarily just cancer. But I do strongly encourage you to go talk to your doctor and get blood tests done if you haven't already. You know, worst case scenario, you know, you find out something's going on, but you know, it could also just be something simple going on. But it's always best to know, in my opinion, it's always best to know what's going on. That way you can form a plan of attack, so to say. And again, to you, you know, whatever it is, just, you know, stay strong and stay positive. You can get through it, whatever it is. And I think that those are the only comments that I saw on my notifications here on my my phone. So I'm sure there's more comments. I'm not, you know, how technology is. So I will go through and comment on everyone's post, like I said. So please keep asking me questions. I promise I will try to be better with keeping these vlogs updated. I don't even have a good excuse. Like I said, it's just I've been busy and I'm tired when I get home from work, and you know, excuses, excuses, excuses. But I hope that everyone is doing okay. My thoughts and prayers are with you all, and just wishing you all, you know, strength during your times of struggle, or even, you know, just also wishing happiness for everyone. So again, just leave me comments below. Let me know if there's anything in particular that you want me to talk about. Hopefully I will be, you know, giving an update here soon. In the very least, I will give an update here in another month or so once I hit my +1 year. I'm sure I'm going to have all kinds of fifis, all kinds of feelings and emotions about that, because it's been crazy, it's been incredible, it's been horrible, it's been a blessing, it's been so many different things. But yeah, so I will catch up with you all soon, and in the meantime, just take care, everybody.